let's test your knowledge on medications and their antidotes. Okay, so question 1. A patient is admitted to the hospital for diazepam overdose. What is the antidote for this medication? So you guys should know that diazepam is a benzodiazepine. These drugs usually end in PAM or LAM, and the MRCP lectures also teach you that these drugs usually have ZEP in them, ZEP, so that's another way to identify them. So this question is asking what is the antidote for benzodiazepines. Take a moment, pause it if you need to. The answer choice to this question is letter C, flumazenil. Diazepam is a benzodiazepine, and we know the antidote or reversal agent for this drug is flumazenil. Okay, number 2, your patient's receiving morphine post-op. The patient is now exhibiting severe respiratory depression. What medication do you anticipate the HCP to order for this patient? So we know that severe respiratory depression or any respiratory depression at all is not an expected finding for morphine administration. So this usually indicates morphine overdose or toxicity. So what drug would we anticipate for a morphine overdose? Take a moment, pause it if you need to, but the answer choice to this question is going to be letter B. Respiratory depression is a sign of morphine toxicity or overdose. Therefore, the reversal agent or antidote of naloxone, otherwise known as Narcan, will be the anticipated medication ordered by the HCP. Okay, number 3, a patient is experiencing digoxin toxicity. What is the antidote for this medication? So this question is pretty straightforward. These can be known as freebies on the NCLEX. Either you know it or you don't. Take a moment, pause it if you need to, but the answer choice for this question is option B, Digibind. Okay, number 4. Magnesium sulfate was given to a pregnant client and decreased deep tendon reflexes are noted. What nursing intervention should be implemented by the nurse? Select all that apply. So a good trick for select all that apply questions, especially on the NCLEX, is to cover up the answers or not look at them and just kind of think to yourself what the answers might be prior to looking at the answers that they give you. Another good strategy for select all that apply questions is to treat each one like a true or false as its own individual answer. So go ahead and take a moment. The answers to this question are going to be B, C, and E. Decreased deep tendon reflexes are a sign of magnesium toxicity, so you should stop the infusion, notify the healthcare provider, and get the antidote of calcium gluconate.